Seniors portrayed in 2025 budget, the benefits slash cost rise. Are you affected? Definitely they paid their dues, they worked 40 years, they fought wars, raised families, built this country, and now in 2025 we are slashing their benefits. Look at this 2025 budget impacts. The House bill could cut assistance and raise costs for the seniors. According to this bombshell report from the Center on the Budget and Policy Priorities, a new House bill could cut the assistance and raise costs for the seniors across the country. This is not just a rumor, really it's happening. Let me show you exactly what's inside the bill. Look at this. Threatening funding for the home and community-based care, the House bill could shift costs to the states, including through a new restriction on how states can finance their share of the Medicaid, which could lead states to cut back on the health care services for the seniors. States unable to backfill or those cuts may look to cut back on the services they are not required to provide under the Medicaid, including home and community-based care for the frail seniors and the people with disabilities. Actually, this bill threatens the funding for the most vulnerable seniors who rely on the Medicaid for the home cares, nursing homes, and essential Medicare services. It pushes the cost onto the states, and when states can't pay, they cut services, definitely, which means you lose coverage. For the millions and the millions of the seniors, this could mean being forced out of the nursing homes or losing home-based care entirely. Let's go deeper. Let me show you what's hidden between the lines. The headline says it all. The seniors will face higher costs at a time they can't afford it. Look at this. CBO estimates that the 5.2 million adults will lose the Medicaid under this work requirement, which could apply to the individuals up to age of 64. Many analysts think the number could be higher, the losing coverage. States will face the new restriction on the Medicaid funding, and that means the less healthcare access for those who need it most. Some parts of the Medicare might be untouched, but don't let distract you from the larger cutbacks. Over 3 in 5 nursing home residents have their care funded by the Medicaid. This bill could leave them completely stranded. But there is the part that made my blood boil. Definitely, if this bill passes, the seniors, some 65 and older, may be forced to prove they are working in order to keep benefits. Don't believe me? Older adults not showing they meet a work requirement. Can you imagine your 72-year-old father needing to clock in at a job to get healthcare? And it doesn't stop there. The same is being proposed for the food stamps, 22 hours of the work per week or no sport. Look at this. The Medicare Advantage payment changes would have little or no effect on the beneficiaries. Actually, this is the good news. So what's actually being done? Are the lawmakers going to let this happen? A new bill hands off the Social Security was just introduced by John Lawson and Melanie Stanbury. Their goal to stop the madness, to ensure no one touch the lifeline the millions of the seniors depends on. But here is the problem, it might not pass without the public pressure. So let me say something personally, this is your wake up call. Whether you are a 30 or a 70, this affects you or someone you love. Our elders should not have to beg to live with a dignity. If we let this slide, what happened to the next generation? Let your voice be heard. Share this, speak up, comment below with your thoughts, because this is the fight needs all of us. I am leaving a question for you. In 2025, will the seniors be left behind? Take care. Have a nice day.